my name is Jay, and my story is very simple. I was a chiropractor, and I was getting adjusted and I lost my health. Real simple. There are things that we don't learn in chiropractic school and I wasn't taught about, and because I didn't know about them, I didn't know the answer as to why I lost my health. So basically what happened was I got sick. I'd always been healthy. I'd always been, fairly decent, body shape, size and stuff that way. But what happened was, over the course of time, I developed a spinal structural related disorder, and this is it right here if you want to see it. I developed a thoracic kyphosis right through here. You can see the green line is normal, red line's where it's at. No matter how much I got adjusted, it would not fix that. I was adjusted from the time that I was born. Now this came about because of repetitive activity and motion. I was a massage therapist, I raced bicycles, so I was hunched over on my bike, I was hunched over a table, I was adjusting. And what it did was those nerves in that area became compressed, smashed, the spinal cord got stretched, and it altered the message coming from my brain to my stomach. I developed acid reflux, indigestion, stomach pains, heartburn. I went to the local hospitals and they did, because I had lost 10 pounds because I couldn't eat. I lost 20 pounds, I'm sorry, from December 10th to January the 17th, my sister's birthday to my birthday. And for a guy my size, that looks kind of odd when you get down to be about 145 pounds. It's just not healthy. And I had stomach pain. I was eating drugs. I was taking Tagamet, Protonics, Prilosec, Omeprazole, Malox, Mylanta, you name it. I was drinking baking soda and water just to get the acid down in my stomach. Food would fly through me, undigested. I wasn't getting the nutrients I needed out of it. And so I went to the medical, for the medications to see if that would help. It stopped working, not as effectively. And so then I chose to go on to the next step, and that was Pop Rocks and Chalk. $1,500 later, they just gave me a prescription for the same drug. And so I went to another hospital because I thought, I must be dying of cancer or something. There must be a tumor in my stomach. Let's see. So they went down with an endoscopy, which my insurance company didn't cover, and I was left with I think $3,000 bill, something like that, as a student at the time. And they said, you have gastritis, and what did they give me? Another prescription. So when I found Chiropractic BioPhysics in biomechanics, which said it could fix this, I was intrigued. And when I started working on it, I realized it started working. My stomach symptoms actually got a little worse at first as we were pulling through that area and straightening it out and stretching ligaments that you can't stretch with physical therapy. You have to have traction. You can't do it with an adjustment. Yoga won't touch it because I know I tried everything. But as I stretched that out and as I got my health back and my structure back, my brain began to communicate with my stomach again, and it began to work again. Now I can eat hot foods. I can eat darn near anything I want. I don't have chronic diarrhea. I'm not seeing food come out undigested. I have my energy levels back. As a result from this, I had gotten leaky gut syndrome, and I have bad bacteria growing in my intestinal system, and that led to an autoimmune disease where I couldn't tie my shoes. I couldn't zip my pants. I had to wear slip-ons. I couldn't work normally. I couldn't adjust people. I lost identity. I got angry. I wasn't nice to my friends or my family. And it really affected my relationships. And so by working on this and getting my health back, I'm now 46 years old. I sat, ranked number one for 44-year-old males. Well, I'm not 46 yet, I guess. So by doing this, I got my health back. Last year when I was 44, I was able to hold a number one national position in road cycling for my age group at 44. And it all comes because I fixed structure, I cleaned my gut, and I just took steps towards solving the problems rather than just covering them up with drugs. If this, is something that you've experienced or someone else has, maybe it could help. And if you're open to discover, could this help me? Consultations are complimentary. There's no fee for coming in and just sitting and talking and finding out if it could help. If you want help from there, we make it affordable for everybody. We don't turn people away based on economic ability. But you have to prioritize your health, right? That's the basics.